Welcome, Secretary of State, and I'd like to discuss a bit about adult social care. Now, the Operation Yellowhammer documents published by the government after much dilly-dallying and protracted delays, finally published in September, revealed that a no-deal Brexit could lead to, and I quote, provider failure in the adult social care sector, particularly if inflation leads to a higher staff and supply costs. So are the government's concerns regarding social care satisfied with the government's new withdrawal agreement with the European Union?
Well, we're very conscious of the impact of Brexit on adult social care, and this has been one of the focuses of our work. As local government secretary, obviously I've been in close communication with local councils through all of the things I've just described, like the creation of Brexit lead officers. We've been gathering the thoughts of local councils on the current and likely impact of Brexit on social care. To date, we haven't seen any sign of a Brexit impact on adult social care. We've been working carefully with them to prepare plans alongside the Department of Health and Social Care through a couple of lenses. Firstly, the workforce, ensuring that social care can continue to have the individuals that they need and rely upon. As I say, at the moment I'm told that there's no signs of a Brexit impact there. We've worked carefully on access to medicines with the Department for Health and Social Care, and they've drawn up very comprehensive plans covering every single medicine in the country, and a number of councils were understandably concerned that care homes and so on would have access to medicines and that they would be treated on a par with hospitals and with GP surgeries and so on. That is the case, and we've been providing as much reassurance as we can there. In the meetings that I have with local councils, the Department for Health is represented, and health ministers listen to the concerns of local councils and hopefully act upon them. In terms of provider failure, well, the Department for Health and Social Care do have a well-tested system for this, which has been used in the past in a non-Brexit situation, which is where they would work with local CQCs and councils in that eventuality, and they have tested that for a Brexit situation, and they're currently, I'm told, confident of their plans.
Even in a no-deal scenario?
Yes.
That they are happy, so that they do not fear provider failure?
Well, provider failure has been identified as a concern in a no-deal Brexit situation, but the DHSC has tested their planning and are confident that the current system that they have of bringing together the CQC and the council to overcome any concerns is sufficient.
Okay. Well, look, on taking office, the Prime Minister made various grand statements, and one of those was that, and I'll quote, "We will fix the crisis in social care once and for all with a clear plan we have prepared." So where is this clear plan?
Well, the Prime Minister and the whole government is committed to bring forward proposals. We recognise, as I think you will do as well, this is one of the biggest issues of our time, and we need to address it. There is no consensus at the moment on the way forwards, but we believe it's absolutely essential that the government provides leadership and brings forward proposals. I can't give you a timetable as to when we're going to do that, other than to say that we are working across government. I'm in discussions with the Secretary of State for Health and Social Care, and we will, as a government, be bringing forward proposals when we can. My first priority as Secretary of State was to ensure that we secured a settlement for the next financial year, which put the sector on a sustainable footing and a platform on which it could build. Now, I appreciate that was only a one-year settlement, which was a product of the situation we found ourselves approaching the 31st of October. But the settlement we achieved has been widely, I think, recognised as a good one, which does provide that platform. Obviously, the task for me as Secretary of State will be to ensure that when we come next year to the multi-year settlement, that is truly one which provides a longer-term sustainable footing for the sector.
But Secretary of State, I mean, with all due respect, we're not talking about the settlements. What we're talking about is the Prime Minister said, we have a clear plan. You just mentioned that there was no consensus, But if he has said that there's a clear plan, then surely the clear plan should be laid out before all of us. Now that has not happened. In fact, even the green paper on social care has not been laid out. When do you think that will finally be published?
Well, I can't give you a timetable for that other than to say that from my perspective, it is right that we take time and get this right. And that's what we intend to do. But in the meantime, my focus will be ensuring that the current system is sustainable. And as I say, the first challenge for me as Secretary of State was to ensure that in our negotiations with the Treasury, local government had a settlement which enabled the system to continue and to be a platform which we could build. And that, from the representations that I've heard before and since from the Local Government Association and others, I think has been well received by stakeholders.
Yeah, I know you keep on referring to the settlements, but as I said, what I'm referring to is that clear plan. And even in the 2017 spring budget, we were promised a green paper on social care. So from your responses, what I take is that there is no clear plan and there is no proposals in terms of putting the green paper on social care before all of us. So I think that's where we are with regards to that. Well, look, in terms of a plan, there was a plan put forward in June 2018 when this committee published a joint report along with the Health Committee and whereby we called for a social care premium. So in essence, it's like national insurance to be paid by people over the age of 45. However, the committee has not received a response to this report, and that's 18 months later. Don't you find that that's awfully discourteous, that we haven't received a response for 18 months?
Well, I think with respect, you received a holding letter from the Secretary of State,
months.
And he then said that he would respond to you as soon as the government was able to bring forward its proposals, which, as I said, we will do as soon as we can. But I don't think there's anything more I can productively add other than that.
So we don't know, in terms of as a response, you don't know when we could get a response after 18 months, and then you still, you can't tell us whether the government is considering our plan?
Well, the government is considering your plan as one of a wide range of representations we've received, but we'll be bringing forward our own proposals in due course. As I said, I can't give you a timetable today.